Clear cell renal cell carcinoma patients are treated quite successfully since 2005 in a metastatic setting with VEGF receptor tyrosine kinase inhibitors. One of the most frequently used compounds in first-line therapy is sunitinib. Although in other malignant diseases treated with targeted agents, predictive biomarkers have been discovered, not any molecular predictive biomarker has been discovered in clear cell renal cell carcinoma patients treated with VEGF receptor TKIs. In our publication in the British Journal of Urology International, we now present a possible molecular predictive biomarker in clear cell renal cell carcinoma patients treated with sunitinib as first-line targeted therapy in a metastatic setting. SNPs are variants in our genetic material compatible with life. However, these variants can have a physiologic impact on the function of the encoded protein. This seems to be the case with variant RS9582036 in VEGF receptor 1, one of the main targets of sunitinib. Patients with the CC genotype have an unfavorable outcome when treated with sunitinib. Median progression-free survival is 8 months versus 14 months in patients with the AC and AA genotype. Overall survival is 13 months versus 34 months. Partial response rate is only 8% in the CC genotype patients versus 49% in the others. And there are no long responders in the CC patient group. The CC genotype is present in 9% of the Caucasian population. We have published a first discovery series on 88 patients in 2014, and now in the British Journal of Urology International we publish a validation series of 69 patients. This makes a total patient series of 147 patients. Moreover, recently we have genotyped a new cohort of patients and we have found the same difference in outcome in this third patient series. Recently there have been conflicting results in studies on polymorphisms and outcome. Therefore, further validation of these findings is warranted. We would encourage other research teams to study the impact of this SNP in VEGF receptor 1 in renal cell carcinoma patients treated with sunitinib or other TKIs such as pazopanib. And the impact of this SNP should also be studied in other malignant diseases such as thyroid cancer treated with VEGF receptor tyrosine kinase inhibitors. We are collecting more patients and we are also studying the impact of other SNPs in the VEGF pathway. Publications are in preparation. If validated, this SNP could possibly be used in the treatment tailoring in renal cell carcinoma. And these results show, in any case, the function of VEGF receptor 1 in pathogenesis of clear cell renal cell carcinoma and as a target of sunitinib.